Welcome to Module 17 of our Advanced Wound Care series. In this session, we will explore bioengineered and growth factor therapies. These innovative treatments are transforming the way we approach chronic and non-healing wounds. From skin substitutes to recombinant proteins, these tools allow us to enhance healing where traditional methods fall short. Let's begin by understanding what these therapies are and how nurses can confidently integrate them into daily practice. By the end of this module, you will be able to understand how bioengineered tissue products and growth factors contribute to wound healing, identify the different types of matrices, both cellular and acellular, and know when to use them, describe the key growth factors like PDGF, VEGF, and EGF, and how they help the healing process, demonstrate clinical knowledge around application, patient monitoring, and outcomes, and finally, integrate these therapies into comprehensive, team-based care plans for wounds that aren't responding to conventional treatment. These objectives will guide our journey through this fascinating and important topic. Let's start with the big picture. Bioengineered skin substitutes and growth factor-based therapies are now widely used in the treatment of chronic wounds. You'll often see them used in diabetic foot ulcers, venous leg ulcers, pressure injuries, and even burns or graft donor sites. These advanced products work by mimicking or stimulating the body's natural healing mechanisms. They promote the growth of new tissue, support blood vessel formation, and help close wounds that have stalled. As nurses, we play a critical role in this process, from selecting appropriate therapies to applying products properly and monitoring how patients respond. This is a high-touch, high-responsibility area of care, and your expertise makes all the difference. To understand why bioengineered therapies matter, we need to briefly revisit how wounds normally heal. There are 4 key phases: hemostasis, where bleeding stops; inflammation, where the immune system clears debris; proliferation, where new tissue and blood vessels grow; and remodeling, where the skin strengthens and matures. But in chronic wounds, this sequence breaks down, often due to infection, low oxygen, or insufficient growth factors. That's where these therapies come in. Bioengineered products replace missing components like the extracellular matrix, stimulate cells like fibroblasts and keratinocytes, and promote granulation and blood vessel formation. Think of them as both scaffolding and signal boosters, helping the body restart the healing cycle. Now, let's take a closer look at the products themselves. You'll typically use bioengineered matrices when a wound hasn't responded to standard care after 4 weeks. They're especially useful in diabetic foot ulcers, venous ulcers, burns, and surgical wounds. There are several types of materials available. First, acellular dermal matrices, which provide structural support but no living cells. These act as a scaffold for the body's own cells to migrate into. Next, cellular skin equivalents, like Apligraf, contain living cells that actively promote healing by signaling and releasing growth factors. Xenografts, made from animal tissue, can also be used temporarily to promote granulation. Synthetic scaffolds, including silicone or polymer materials, are designed for specific wound types and often dissolve over time. Finally, cryopreserved allografts are human donor skin products stored frozen, used especially when biologic compatibility is a concern. Each of these products plays a role depending on the wound type, size, and patient condition. Your assessment and knowledge help guide the most effective choice. Before we apply bioengineered matrices or growth factor therapies, we must first screen for contraindications. Avoid use in patients with active infection or systemic sepsis, osteomyelitis, unless it's already managed, malignancy in or near the wound bed, severe vascular insufficiency where blood flow is inadequate, known allergies to human or animal-derived materials. Now, onto the nursing protocols. 1. Start by preparing the wound bed. This includes sharp debridement, managing exudate, and controlling any signs of infection. 2. Use sterile technique throughout the application. 3. Maintain a moist wound environment using appropriate secondary dressings. 4. Immobilize the matrix carefully. especially in high movement areas like joints or feet. 5. Monitor the site closely. Look for integration signs like granulation under the matrix or detachment, which may require reapplication or reassessment. Your role in preparation and follow-up is absolutely critical to the success of these advanced therapies. Now, let's explore growth factor therapies, a breakthrough in stimulating wound healing. These therapies involve applying recombinant or purified human growth factors to stalled wounds. They essentially provide a biological jumpstart when healing has plateaued. Here are the key growth factors used in clinical practice. PDGF, platelet-derived growth factor, stimulates fibroblast activity and collagen production. VEGF, vascular endothelial growth factor, supports angiogenesis or new blood vessel formation. EGF, epidermal growth factor, encourages keratinocyte migration and epithelialization. FGF, fibroblast growth factor, promotes granulation tissue and capillary growth. TGF-beta, transforming growth factor. Beta, assists in matrix remodeling and immune modulation. Most of these are applied topically in gel or spray form. They require a clean, moist wound bed and are often combined with occlusive dressings to support absorption. As nurses, our responsibilities go far beyond just applying the product. You are the front line in ensuring these therapies are successful. Assessment. Monitor wound size, depth, exudate, and granulation tissue weekly. Documentation. Record the exact product used, batch or lot. Number, date, and time of application, and dressing changes. Infection surveillance. Be alert to signs of graft failure or infection. This includes foul odor, increased drainage, redness, or sudden pain. Pain monitoring. Any unexpected or severe tenderness may be an early sign of infection or rejection. Patient education. Reinforce the importance of hygiene and keeping the site undisturbed. Coordination. Communicate with the wound care team, product suppliers, and insurance providers to ensure seamless care delivery. In many ways, you are the glue that holds the entire protocol together. Patient and caregiver education can make or break the success of advanced wound therapies. Here are the key messages to deliver. Do not disturb the dressing unless instructed by the clinical team. Watch for signs such as redness, odor, increased drainage, or graft detachment, and report these immediately. Keep the area clean and protected from trauma or contamination. Stress the importance of attending all follow-up visits. Explain the origin of the product, especially if it's derived from human or animal sources. This helps address ethical, cultural, or allergy-related concerns. And finally, emphasize nutrition. Proper hydration, high-protein diets, and blood glucose control are critical for tissue regeneration and healing. A well-informed patient is more likely to adhere to protocols and heal faster. Let's wrap up with outcomes and what the research shows. Bioengineered and growth factor therapies have been shown to accelerate healing. For example, Becaplermin, a PDGF gel, was shown to close diabetic ulcers 43% faster in clinical trials. Improve graft success. Bioengineered matrices lead to better take rates and faster epithelialization. Reduce costs over time, despite the initial investment. This is due to fewer dressing changes, reduced hospital stays, and fewer infections. In conclusion, these therapies offer biologically targeted solutions for chronic and complex wounds. And nurses, you, are central to their success. From patient assessment and protocol adherence to education and follow-up, your clinical judgment and care coordination ensure optimal outcomes. Thank you for your commitment to advancing wound care. Let's continue to bring science, compassion, and precision to every patient we treat.